Hello,
Recording in progress.
everybody. Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins, the technology, the probably only podcaster doctor in the world who's technologically challenged. In any case, bear with any technological issues that I may have. I appreciate your indulgence. In any case, as you know, our show, if you've been listening to it, or perhaps this is the first time you're listening, is dedicated to giving you natural and safe, that's been important S word, ways of treating diseases and conditions that have probably been thought of as impossible to get rid of. Um, I was saying it to a nurse practitioner, actually to a patient, a potential patient from California just yesterday. What you don't know, you don't know. And when doctors and friends told her there's no answer for your problem, they're telling the truth. As far as they know, there is no answer for that problem, that medical issue. That doesn't mean there isn't one. It's about knowing enough, finding out that there are other answers. And also, doctors tend to be locked into what they learned in school or the way their profession, their specialty thinks about something. And they have a hard time getting out of that box they're locked into and thinking out of it and coming and then searching for answers that may actually be out there. It's unfortunate, but that's the way it is. Uh, I People from my planet, the one that I came from, think differently than that. We think, hey, there has to be an answer to everything that's been created. All we have to do is search for it, and ultimately it can be found. And guess what? There is. It's about wanting to look and finding it. And if you found this show, it's because you have failed to be helped with your medical problems uh, through traditional health care. And hopefully, we have the answers for you here. And the reason I'm able to bring you these answers because of all our commercial sponsors that help pay for the producing of this show. I always thank on my, two sponsors, Promo Life. Promo Life, as you're going to know. By the way, get a pen and paper if you're listening to this show. You're going to need to write some stuff down. So if you're listening live, you just run out and get it. Otherwise, if you're listening to the replays of the show, just put it on pause, get yourself your pen and paper because you're going to want to write these things down. So first, I have to thank Promo Life. Very important for you for these two conditions we're talking about today, Bell's palsy and trigeminal neuralgia. And you're going to see why I'm going to throw in a couple of others that weren't listed in a minute or two when we get to it. And Promo Life makes home care ozone devices, generators to make the ozone gas, and as well as home care devices and equipment so that you can treat yourself at home. We're not talking about intravenous ozone now, we're talking about home care ozone. And we've done shows on it so you can listen. Promo Life, you want to reach them if you're going to get set up for this, and you're probably going to want to write this number down at 888 742 3404. That's 888 742 3404. And you tell them you heard about it here on the show. They'll do something special for you. Their website is promolife, promolife.com, and you could look at all their different products and everything. But to help you with these conditions, particularly if you live in places where intravenous ozone is not available, You're going to want to get hold of them. And they make machines that literally can be used around the world. And we're heard in over 80 countries now. So it's more than worth that call to the US. Remember, the US is a +1 area code, country code, and then it's 888-742-3404. In addition, and I can't emphasize how important this is, and yes, they do ship around the world, though while it's free shipping in the continental US, you will pay extra if you live out of the continental United States. But you're going to want to go to doctorsbiome.com. Doctors, DOCTORSBIOME.com, and you're going to want to buy the gut health product, and you're going to want to start taking it as soon as you can possibly get it. It is that essential in helping both Bell's palsy and trigeminal neuralgia. And you're going to learn why and how the gut interacts with your facial nerves. Kind of amazing. But you'll learn about the gut-brain axis on this show. What we're going to do, the way I'm going to try to organize it, because many of you may or may not know what we're talking about. If you certainly you're suffering from it, you know everything I'm talking about. This may be helpful for your family. They may not understand things, but it's important to understand what the problem is, what the medical problem is, what the causes might be, and that's very important. And then you'll understand how we fix it. Okay? So we'll start with Bell's palsy. Bell's palsy, horrible, painful condition. It's what happens, and it doesn't always have to be terribly painful, though it often is a temporary weakness or even paralysis on one side of your face. Your eyelids will droop, your jaw will droop like this. It's pretty bad. Your eyes will, tear, but in any case, it seems to come on suddenly. It's certainly an inflammation or something that's affecting what's called the seventh cranial nerve to one side of your face. They often say it's an unexplained episode of muscle facial weakness or paralysis, but I have an explanation for it. Generally, it begins slowly, but it gets worse over the next day or two, sometimes a little more. And it can be anywhere from just mild discomfort to severe pain. Can affect anybody at any age, though it's generally adults that get it. Interestingly enough, most often in pregnant women. That's where we run into a little bit of a problem, as you're going to learn about how to treat it. We may have to wait, depending on where you live, until after you've given birth. But many other causative, apparently related factors, if you go to all the major websites, the Mayo Clinic, the John Hopkins Clinic, the Cleveland Clinic, all these experts on these things, they'll tell you that there's a lot of things that can influence whether or not this occurs. Diabetes seems to be common in many people. You'll understand why when I tell you what the real cause is. Flus like viruses like influenza, or some they're thinking the herpes simplex viral infection can cause it. Cold virus, rhinovirus that has been related to it. What else? Let me think. Lyme disease, Guillain-Barré syndrome, sarcoidosis, autoimmune problems seem to be related to it. Okay. Now, the real cause, as you're going to learn, the real cause, I believe, is the herpes zoster virus, chickenpox. Now, that doesn't mean you can't have something else, an injury or some other thing affecting that nerve, another virus affecting that nerve. It's true, it's possible. But I absolutely believe that it's the herpes zoster virus. Every single patient I've seen, this is my 52nd year as a doctor. And uh, everybody that I've ever seen so far has had chickenpox. And when chickenpox goes away, it doesn't disappear. The virus goes into remission. And when it flares up again, you know what a flare up might be, because when it affects the superficial sensory nerves in the skin, it causes an inflammatory response in the skin. Okay, you get blisters and pain, extreme severe pain, and we call that shingles. Okay, I believe when it attacks the seventh cranial nerve, it's called Bell's palsy. One day I'm going to be proven brilliant and they'll give me a Nobel Prize nomination. Hopefully you can only get them when you're alive, because I came up with this bright thing and have the answer for fixing it. And we've had nothing but success in eliminating it, apparently permanently, completely, once and for all. When the herpes simplex virus, and let me just go a little bit more on this one before I get into trigeminal neuralgia. Okay. But you know what? I think we still have some time before we have to go to our first commercial break. So what happens is you get, and the symptoms of this is a drooping eyelid, a drooping side of your mouth. You may start to salivate and, have uncontrolled, leakage from your mouth. Sounds a little weird. Vision issues, of course, in that eye. You'll have difficulty closing the eye on that side. You may get a loss of taste on that side of your mouth. It's kind of weird, but you can actually figure. Numbness is okay, believe it or not. If you touch yourself and you don't feel it, that's not a bad thing, because pain is another common problem here, and that is not fun. But you can also become hypersensitive, hyperacusis, where even just the slightest touch can be uncomfortable or painful. So tearing, saliva, you have problems eating and drinking, you may have some trouble swallowing. Very common. All the things they look to treat it with are a waste of time, money, and effort, and even can be dangerous. They like to give corticosteroids, to reduce inflammation. Drops to help your eye, I guess they're okay, particularly if you use the natural drops to keep the eyes moist. They'll send you out for physical therapy, which I am not against. But you got to get rid of the cause. And if you don't get rid of the cause, you're not going to fix it. Okay. Now, the statistics show that about 70 to 80% of the people with Bell's palsy will recover fully within about 6 months. What if you're in the 20 to 30% that don't? That's who's listening to this show. Okay. You fall into that 30% group who 3 out of 10 who are still suffering from it. And if you look at the literature, you find that in some cases, this problem is permanent, absolutely permanent. And that's pretty scary. It can happen to anybody at any age, though generally you see it happen in adults, 20 to 60, 70 years old. Okay. Very important to understand it's not contagious. Okay. You're not going to give it to somebody else. You can kiss, you can touch, you can hug. Okay. Because if you've had what I believe is the virus that's causing it, you already have it and you're not in a contagious state. You had chicken pox when you were a kid. And that's why chicken pox is a serious viral condition. The herpes zoster virus is a very serious virus. As we get older, if we get it when we're older, it becomes uh, much more serious in terms of its effects on our body. But getting vaccinated for it is a big mistake. Uh, it can be more harmful than the virus itself in the long run. And if you don't have it, don't worry about getting it because it's not as common as it used to be in terms of catching it. And if you stay away from people that you know have it while they're in the contagious state, you don't have to worry about it. As you're going to learn when we get into treatment with pregnancy, it becomes an issue, not because we can't help it and fix it in pregnancy, but because of lawyers and the nature of people here in the USA, and I dare say perhaps even in other countries. We live in a very litigious society, and it's a problem that we're all faced with is that people can get upset and want to come and sue the doctor who's just been doing nothing but trying to help get you over a problem. Um, Trigeminal neuralgia. We're going to touch on it now and very shortly go to our first commercial break, finish up with it, and then we're going to talk about how to get rid of these things permanently, completely, once and for all. Okay. So trigeminal neuralgia, TN, sometimes it's called that. It's also known as tic douloureux. I always like that name, tic douloureux. It's a it becomes a chronic pain problem, though when it comes on, oh my God, is it painful and severe? But it can stay that way. And it affects the trigeminal nerve, which is the main sensory nerve of the face. Sensory nerve. Okay. Herpes zoster, you're starting to see the connection. Shingles. So intense pain, in this case, similar to like getting an electric shock, okay, when it hits you. And again, on one side of the face, okay. I don't know. I'm not saying that it can affect both sides like shingles can, but it generally doesn't. So one side of the face, even light touch or brushing against something can bring on excruciating pain. I mean, really horrible pain. You know what? Let's go to our first commercial break. As soon as we come back, we're going to get a little more into it and we're going to tell you how you can get rid of it. Okay, everybody, stay with us. We'll be right back.
Recording in progress.
Okay, everybody, we're back again. Thanks for hanging in with us. And we're talking about now trigeminal neuralgia. I think it's also called TN. All right, everybody likes to use medical alphabet soup. So, one of the mistakes they make is believing that a swelling of a blood vessel near your brain stem can cause this to happen. It isn't the cause. If there is that swelling, which they have found, it's because of an inflammation that's taking place. And the inflammation is causing the blood vessel to swell. And I believe it's virally caused, as you're going to see why. It starts with very often, from what the patients have told me, short, mild episodes of pain, but it generally gets worse. And the pain lasts for longer and longer periods of time. It's more common in women than men. Don't know why they claim that it's a predilection for women, but men get it just as much. And mostly people over the age of 50. Now, why would that be? Well, your immune system is weakening. I want you to understand why what we're going to do is going to work and help. Over 150 to 200,000 people every year get it here in the US. Worldwide, I can only imagine it's probably, maybe even as much as 1 million people a year. Certainly 500,000 people a year will be getting this every year. Start doing the math. Okay. In 10 years, over 1 million people just in the USA alone will have suffered from this. And again, if you go to all the major clinics and their websites and ask about it, they go, well, we don't really know what causes it. Okay. They related certain things to it. For example, multiple sclerosis. So it is my opinion that the herpes zoster virus, so you get chicken pox, okay? And it's gone after a week or two, you're back to normal again. And what happens is, and this is pretty well documented, the virus goes dormant and moves itself and lays in the base of your spine in what's called the dorsal root ganglia of your spine. Now, when your immune system weakens, that virus can flare up and affect any part of your body. And when it affects the sensory nerves in your skin, we know what it's called. It's called shingles. I believe when it affects the motor nerves to your muscles, it's called multiple sclerosis. Now, there's other things that are related and that they call multiple sclerosis, but it definitely, I believe, can be doing that. When it moseys its way up your spine and starts to paralyze not only your voluntary but your involuntary muscles, I believe it's called ALS, amyotrophic lateral sclerosis, Lou Gehrig's disease. When it affects the trigeminal nerve, trigeminal neuralgia, and when it affects the 7th cranial nerve, Bell's palsy. And that's why you see a lot of this in the face and head, because you see a lot of shingles there as well. So this has been my firm opinion over the years. They like to try to give what they call their typical causes of it. If you look at their websites, they call a classic TN when the blood vessel, superior cerebellar artery enlarges and it pushes up against the trigeminal nerve. It's inflamed. Why? The herpes zoster virus is inflaming it. Um, or the body is trying to bring blood in to help the fight the viral infection that's ensuing in that area. That is a second possibility from my way of thinking. Maybe I'm wrong, but I don't think so. You can also have an injury, okay, that can affect the trigeminal nerve. It's possible, okay. Tumors might affect it. There's also, that's a possibility, but there you can have a tumor hopefully cut out and removed by a neurosurgeon. Today, it's amazing how great they are at not damaging the nerve and yet being able, with lasers and whatnot to cut out these tumors. But there's a way to help that, and you're going to learn as we talk about the treatment for it, if you're going to need it at all. But most of the time, they like to call it idiopathic. That means they don't have a clear reason why you've got it. Okay. Now, once again, everybody describes it as an electric shock-like pain, stabbing, burning, throbbing. It can affect your forehead, your upper and lower jaw on one side. Certain things can trigger it, like brushing your teeth or washing your face, eating, talking, even talking. All right. So all these things are there are many triggers, but burning, throbbing, numbness, dull achiness is also possible. It doesn't have to be severe pain or electric shocks all the time. Those feelings are all what we call paresthesias: burning, pins and needles, tingling, itching, numb sensations, are all paresthesias, and we call them that. And that's in between. That's what you can hope for when the severe pain and electric shocks have stopped. Okay. These episodes of pain can last anywhere from days to weeks to months, or permanent even. You may have a period where there's no discomfort or pain at all. That's a wonderful thing. Why? Your immune system is boosted up and put the virus into some remission. It just doesn't generally just go away by itself. You may feel it in your gums, in your teeth, in your tongue. Okay. Different sensations. Pretty bad. They've tried nerve blocks. They've tried all sorts of different things to try to fix it. And even surgery to decompress the nerve or destroy the part of the nerve that's responsible for the pain. Big mistakes, big mistakes. Okay. So let's start talking. And by the way, I ought to throw in multiple sclerosis and ALS, because these are life-taking diseases. I believe it's the exact same virus that's doing all the harm. I don't believe it's a rhinovirus. I don't believe that it's herpes simplex. Those viruses do not kill people. They may make you wish you were dead. We've done shows on them, but they don't kill people. These viruses can kill people. This virus can kill people. It's pretty severe. It can pervade your body. If it gets into your brain, it can cause all sorts of brain inflammations, depending on which parts of the brain that it has entered. All right. So it's a very serious infection, herpes zoster, which I'm absolutely certain is the cause of this problem. But who cares in the long run if I'm wrong? Academically, I care, because I train doctors literally from around the world. I lecture literally around the world at medical meetings, often at people meetings as well, coming into my big lecture series, my spring series now. Depending on when you're listening to the show, look at the date that it was first aired, and I'm coming up to my what I call late winter, early midwinter to early spring lecture series, where I go around different medical meetings and whatnot. And from what I've been able to detect and see, this virus is probably one of the worst viruses that people could ever get because of its long-term effects on the body. Viruses do not go away. At best, they go into remission, and they may never flare up again. You get a flu virus one year, you may never get that flu virus isn't going to flare up again and come back the following year. I guess they go into permanent remission. Um, but you can always get infected with a new one. The key thing to understand is that part of your immune system is now weakened. The T cell portion of your immune system, the part of the immune system that fights virus, fungus, yeast, and mold. Very commonly, people have these other comorbidities, these other medical infections and medical problems. I don't know anybody that's listening to this show, just about, that doesn't have excessive yeast overgrowth in their gut, candidiasis. Look up the symptoms. You may have some of them. Why? If you have taken an antibiotic even once in your lifetime, if you eat red meat or chicken that isn't organic or farm-raised fish, I don't care if you burn the meat, you're going to get uncooked out doses of antibiotics. What antibiotics do, obviously, is they kill bacteria, hopefully harmful bacteria, but unfortunately, they can't differentiate from the good ones, and they often can kill the good biome, the probiotics that are supposedly living in the wall of your gut. Hopefully, you have some. Well, the antibiotics destroyed them all. Now, what are you going to do? Okay. Now, what are you going to do? And that's where Doctor's Biome comes in. Now, why this is important in all these conditions that I've named, Bell's palsy, trigeminal neuralgia, MS, ALS, shingles, why this is important is because if you don't get yeast and balance back in your gut, your T cell portion will be weak, which means your own body's immune system cannot fight the virus, any of the viruses that we're infected with effectively. It's already weakened. And that's why people have flare-ups and remissions, and things come up and down. And the key is to boost that part of your immune system. And the easiest way is with Doctor's Biome. Doctor's Biome is a delicious organic beverage, meaning all the bacteria, the 15 proprietary patented strains, are next generation probiotics. They're created to survive the stomach over 90%, whereas capsule powders and tablets are literally destroyed over 90%. If you're taking a capsule powder or a tablet probiotic, in my opinion, you are completely wasting your money, and you are getting little to no benefit out of it other than the possibility of a placebo or some very small benefit, if any of it actually can come back to life out of suspended animation, grow into healthy adults, and be the type that not only survive the stomach, but stick to the wall of the gut. And those bacteria that can stick to the wall of the gut to help get yeast in balance again are called smart probiotics. They did not go to Harvard or Yale to get a degree. They actually change their genetic expression when they reach your gut wall. Okay. So when they reach your gut wall, these bacteria can grab onto the cells there and become part of you. And then you need bacteria that balance each other out, that don't overwhelm each other, as many different probiotics can, like Saccharomyces, Boulardii, and whatnot. Uh, so you need bacteria that don't overwhelm, and you need bacteria that don't cause fermentation. That's another problem with probiotics. Doctor's Biome has no fermentation at all because all the bacteria are living and growing in number. So they're not first coming back to life. They're already living and growing in number in a delicious 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it's vegan, it's kosher, it's halal, it's safe, published in medical journals on its benefits and its safety, and how it's been helpful in fighting MS. And that's why I know, and I've proven we've proven in our clinic, it's helpful in fighting all these viral infections that we're talking about today. And the problems that we have seen today have improved just by taking that alone. But in conjunction with what we'll be talking about shortly when we come back from our last break, is going to be vital to getting well quickly. Don't put all your eggs in the probiotic basket, and you go to doctorsbiome.com, doctorsbiome.com, and it's not a cheap product. So if you put the code radio20 in, you'll get, I believe, 20% off your first order. Okay. 20% off your first order. And then you could use the code after that. After the first order, you're only allowed one. I'll let you all who are listening to this show use my patient coupon code, Howard35. If you use the code Howard35, you'll get 10% off um, your subsequent orders. Okay. And auto ship allows you another 10% priority shipping. It's not a cheap product because nothing cheap is good and nothing good is cheap is an expression for a reason, but it's an extremely effective product and it's delicious. So even children can take it and enjoy it. But the thing is, it works. And that is the key thing. It absolutely works. Now, you can do other things in addition to taking this as essential to boost your immune system. One of them is vitamin C. If you've heard previous shows, and another show you want to listen to if you're listening to this, another podcast is called Intravenous Ozone Therapy. Everything you need to know here on my website here on Voice America. Intravenous ozone therapy, everything you need to know. That show goes over all the different methods and why we use the ones that we use, the most powerful ones. But you need to replenish healthy bacteria because ozone therapy, as you're going to learn, can kill the good boys too, like antibiotics, just not as instantly. And therefore, you have to put the good boys back in on a daily basis. But vitamin C, all my patients take it 5 or 6 times a day, not just once or twice, but 5 or 6 times a day. Very important that you do that because it's only in your system for 2 hours maximum, and you use what you need and urinate the rest away. And you got to use quality vitamin C, not cheap crap, which may come from corn as a source. So make sure you're using quality product. I think we're going to go to our last break now. And as soon as we come back, I'm going to tell you the most powerful and effective way of getting rid of these horrible conditions. Everybody, stay with us. We'll be right back.
Recording in progress.
Hello, everybody. I'm back again here on Functional Medicine with me. And now we're going to talk about how you get rid of it. So I left off with vitamin C. There are so many vitamins and supplements you can take to boost your immune system. Um, Foods that you can eat, vitamin A, D, E, B complex is very important in this, particularly for the pain, B12, but B12 you need to have injected. And most of the B12 that's used around the world is worthless crap. It's what's called cyanocobalamine. Cobalamin is B12. Cyanocobalamin is a particular type. It's cheap, it's commonly used, and it's commonly worthless. The better variety is hydroxycobalamin, all right? And uh, there's a couple of types that are much more valuable in terms of injecting. When you get an injection of B12, if it's been absorbed and it's going to have any real value, you should see your urine turn slightly tingy, like pinkish, which says that it makes a real difference. In our clinic, we give 5,000 micrograms of methylcobalamin, the other form of B12 that's highly valuable and utilizable by your body. And because we give such a powerful dosage, and it's completely safe, you urinate what you don't use away, it can help with nerve sensitivity. We've been using it, doctors have been using B12 for ever, as far 50 years that I know of it, and yet it's not indicated by government organizations like the FDA for the treatment of pain and nerve problems. Yet I believe it should be commonly used for them. In any case, oral B12, and I don't care what form it is, to me is going to be, from all my buddies and what we've learned, completely worthless. It's going to be completely destroyed and are virtually unabsorbed. So I don't care who makes it or what they say. I'm in disagreement with that. I am injectable into the muscle B12, methyl or hydroxycobalamin is the way to go. Very valuable, and that you can do even every 5 days. Some doctors will prescribe it so you could do it to yourself at home. Anything that boosts your immune system. Well, you can fight various things with raw garlic. There's various foods that are known to boost the immune system that could be valuable. You want to avoid foods that are high in arginine, like peanuts, chocolate, turkey, nuts of all kinds, and other foods, because arginine causes viruses to flare up. And I believe that's one of the triggers of these two conditions, that it's triggered by sometimes by people eating large amounts of these foods. So look up on the internet foods high in arginine and start to diminish or get rid of them from your diet if you possibly can. And then, of course, you want to take foods and eat foods that are high in lysine, or take supplements of L-lysine. Some of that can get absorbed and can make a difference. Alpha lipoic acid, vitamin C, and N-acetylcysteine, NAC, are valuable because it can increase glutathione in your body, which can help, I believe, in fighting the virus here and helping with your problem. But without a doubt, the main way to get rid of it is intravenous ozone therapy. Now, there's many different methods, 7 or 8 different methods, but the one that works most powerfully against it, and maybe the only one that works against it, is the direct IV method. This is where we take oxygen and ozone gas, and with a very fine needle, very fine gauge needle, even finer than acupuncture needles, insert it into an arm vein. and then we push that gas in slowly. Now, it's the first method of intravenous ozone that was ever used, dating back over 100 years ago. It's still the most commonly used method around the world. I have kind of, as many of my colleagues have said, perfected it into what I have nicknamed RMDIV, Robin's method of direct IV ozone. So we've had nothing but great success against all these viruses and these conditions. Um, uh, we've seen when this method is being used. Um, the blood methods of ozone, the 10 pass method, has some benefits, but not as strong for some reason as the direct IV method. Don't understand why. It should work well. Recirculatory hemoperfusion, EBU, which is blood dialysis ozone therapy, can also be beneficial against it. Yet, the direct IV seems to be the most powerful way to treat this condition. And I've seen nothing over the years but great results in patients who have had this. Within weeks to just a few months, their problem is gone. And some of them have been suffering from it for years. Now, that's not MS and that's not ALS. They can take much longer. But shingles, certainly trigeminal neuralgia and Bell's palsy, amazing results and rapidly. And then the key is frequency. Normally, you need to do medicine every day, usually several times a day. With this medicine, when done using my protocols, even just 3 or 4 treatments a week is enough to get rid of them. But if you can do it more often, and most patients can, if you could do it daily, like our office in Manhattan is open 6 days a week for treatment, you see even amazingly rapid results in most everybody. Let's be fair. No moral and ethical doctor should ever promise or guarantee a result. I don't care if you're successful 10,000 patients in a row. You never know what's going to happen on 10,001 for some reason. But the fact of the matter is, if you stay with this therapy done the way we do it long enough, it should work. In our clinic, the direct IV method, we've been using it of our 34 plus years, 29 of them, and we've done over 370,000 treatments, proving its benefits and its safety. We take Dr. Do No Harm very seriously. Here in New York State, if I killed the patient with a pharmaceutical, my board probably wouldn't even blink an eye. But if I hurt one person with ozone therapy, I'm out of business. They're very tough on functional medicine, natural medicine. And they don't seem to care that all these new pharmaceuticals are just causing nothing but severe risk. They're F&D, fast and dangerous, whereas natural medicine, like ozone therapy, is often what I call S&S, safe but slow. People want to be better weeks before they ever met you, but it takes time to get people well. And if you stay with this therapy long enough, it should work. So you push this gas in very slowly over 2 to 6 minutes. It's actually a very quick treatment. And then it's about what I call 10 minutes of recovery, because in that 10 minutes, the ozone is working, killing off every virus, fungus, yeast, mold, bacteria, parasite, toxin, harmful free radical, and it's also removing toxic metals off nerve tissue, which could be causing these problems also. That is a small percentage of chance, but it's still a chance. And only the direct IV method of ozone seems capable of chelating it, removal of these toxic metals off the nerve tissue. Regular chelation therapy cannot do that. Pretty amazing. It's possible to do more than one treatment a day. It's possible to do two treatments a day by separating them each by 3 hours. That's another thing that we were able to develop and we've used now for quite some time on all the different viruses, from you just any virus you can imagine. We've had nothing but success on Ebola, which we're published on, and others. Nothing but great success. And there's virtually no risk. In all these years, I've only had 2 patients I've had to stop treating because they had an allergic reaction to ozone, which is kind of amazing considering its benefits and its power. Um, and it's easier to win Powerball than to have an allergic reaction to ozone. And if you've tried to win Powerball or any of these lotteries at worldwide, you know how hard that is. Well, it's even harder to have an allergic reaction to ozone. Apparently, I'm one of the few that's ever seen it, because we literally have probably done more intravenous ozone therapy than any one clinic in the world that we know of. Um, Now, in addition, uh, it meets glutathione that your body makes. So when ozone interacts with that glutathione, it creates your own immune products that boosts your own immune system back up again to work for up to a couple of hours more after the ozone is gone. So this direct IV method, and we've learned how to use what I call a glut sandwich. We intravenously inject glutathione with half your ozone, then the glut, then the other half of your ozone. So we sandwich it in, and we get just absolutely amazing results that way. Um, so that is the way to get rid of it. And if you think there's another way, try it first. And if it works, you don't need us. Otherwise, you do. And the way to reach me, if you want to get started, is to call the office and say you've been cleared to come in as a new patient for this problem because you've listened to this podcast. So I've cleared you now. And you call my office in Manhattan at 212-581-0101. That's 212-581-0101, and it's a +1 country code. Then you can email me at ozonedoctor@yahoo.com. OZONEDOCTOR, ozonedoctor@yahoo.com. I will answer your email and tell you how to get in touch with us. You're going to definitely want to get Doctor's Biome. Go to doctorsbiome.com, DOCTORSBIOME.com. Make sure you put the code radio20 in to get 20% off your first order. After that, you can use Howard35 to continue to get a discount because it's not a cheap product, and you take one delicious 2-ounce shot a day. Go to PromoLife, PROMOLIFE.com. Call them, see their products for home care. Call them at 888-742-3404, 888-742-3404. Tell them you heard about it here on the show. They'll give you a discount. They'll do something wonderful, nice for you. They'll make you very happy. Everybody, these conditions are about the worst things that anybody can have practically, other than life-taking disease and conditions, which I think versions of this problem are. Trust me when I say, I promise, do the direct IV ozone, take the Doctor's Biome. You can do home care ozone as well, and we can help you get rid of this permanently, completely, once and for all. Everybody, stay safe, stay healthy, stay well, and tell everybody about our show so you can listen to all these shows that we've done. They're archived and they're timeless. Bye now.